Hello, welcome once again to Senior Focus. I'm your host, Bill Adams. Senior Focus is a show designed for adults over the age of about 50 or so. And we come to you thanks to Armstrong's Channel 20 and 100. And I want to thank Greg Roten, who brings the show to you every week. If you happen to miss any of the show, you could always go to Armstrong On Demand and also to YouTube, where the shows are archived. And you could see many shows from the past seasons. Also, thanks to Austintown Library and the library system, they allow us to use the meeting room here in Austintown. And today we're going to be talking about pharmacy and your pharmacist, and maybe how you could establish a better relationship and some questions you can ask. And we're joined by Kevin Fuschetto,
Yep.
Correct?
Mm-hmm.
And Kevin is with Giant Eagle, and he's at the Boardman store.
Correct. Yeah, I cover the whole Youngstown area. Some of our different specialized programs that we do.
And before we get started, maybe just talk about, we just talked before the show that you've been there for about 10 years?
Yeah, this will be going into my 10th year. Graduated from Ohio Northern in 2007, so I've been with Giant Eagle since then.
Mm-hmm. And beyond that, you're also on the regional board, I believe, of the Pharmacist Association. You want to describe a little bit about that?
Sure. Yeah. So I am part of our board of trustees for the Ohio Pharmacists Association. Mm-hmm. Basically, my region is District 14, which covers just about all of Northeast Ohio. So I represent all the pharmacists in that area for the Ohio Pharmacists Association. Well,
and we have a good person to talk with regarding, again, medications for seniors. And, we're at a time of the year, and you may be seeing this later because we replay the show, from time to time. But at this point, we're sort of at the enrollment period for Medicare. And also we have things like immunization. And so we'll maybe start out with, if you want, with the enrollment period.
Sure. So every year, if you're involved in Medicare or going to be starting Medicare, you're new to Medicare, or if you have an existing plan, there's an open enrollment period annually. So it goes from October 15th to December 7th. So if you have not signed up for a Medicare plan yet, now's the time to do it. Mm-hmm. So every year you get to be able to review your plan. You get to review different plans, compare plans, and it's really a pretty simple process now. There's two main ways you can do it. You can go to medicare.gov,
right,
or you can call 1-800-MEDICARE, and it's a really simple process. It's 4 steps. They basically ask you, do you have Medicare? How do you get your Medicare? Where do you live? You type in what medications you're on. You get to select your own pharmacies, and then you get a summary of your plan. So you can look through each individual one, you can compare them, see what's best for you. They give you information about drug pricing, your deductible, all the information that you can possibly need to figure out what plan works best for you, because there's so many plans out there, and it's very individualized on what medications you're on. So you want to type in your medications, make sure you find something that has the best coverage for you.
Right, and that's probably a good idea, every single year to do that. If you've been on Medicare for a few years, I think, a lot of people just tend to, hey, I've got this, I'm just going to stay with what I got. But it's probably best to review annually.
Every year. Plans change every year. Your medications change every year. So it's time to check those medications again, compare those plans, see what's going to be the best. You can actually end up saving yourself a lot of money just by doing this on an annual basis. Mm-hmm. So don't stick with what you have. You might have a great plan. You might stick with it. But look and see what else is out there. There might be some new plans.
Yeah, are there any changes as far as pricing? I mean, I know with the Affordable Care Act, there was some help with the donut hole, I believe.
Sure. Yeah. So the donut hole, that's the Medicare coverage gap. So that starts when you and your plan have spent $3,700 out of pocket, basically. And basically you're in that coverage gap until in 2017 you spent just under $5,000. So that gap has closed a little bit. And basically what will happen is when you're in that coverage gap, your costs, unfortunately, for medications go up. According to the Affordable Care Act and the donut hole regulations for 2017, you'll pay no more than 40% of the plan's cost for brand name medications. Okay. Generic medications, you'll pay no more than 51% of the plan's cost for that. So it's really important when you're shopping these plans, you figure out which ones have the best cost, which ones have the best drug coverage, because that can really affect you if you're going to get into that donut hole. Yeah,
I'm glad you brought up generics versus sort of brand name. is that something that people should be talking about with their doctor, about maybe looking into the generics as an alternative? Because I know they can be a lot cheaper.
Yeah, absolutely. Your doctors may prescribe something for you, and it may be the best medications there, but there may be lower cost alternatives. So if cost is an issue, definitely bring it up with your doctor and ask them, is there any generics available? One of the great things about being a pharmacist is that we know a lot of that information. So talk to your pharmacist about what generic alternatives are available. Are these medications the best for my insurance, best for me? And that can really help lower your cost.
There are also some programs, I believe, to help seniors, especially low-income seniors, with some of the cost. Where would they go for information on that? Is that Medicare.gov?
Yeah, Medicare.gov will give a lot of information on that. There's also a lot of, I would say, like third-party companies that can help you with the enrollment.
Okay.
One of them, for instance, is Medicareful. So, there's a lot out there. You can contact it. I would just kind of search that and reach out to them if you need help, if you need assistance selecting the best plans or finding that coverage for you. The other great thing I was just going to mention, when you're actually looking, say if you're logged into Medicare.gov and you're comparing, each one of these plans, they'll give you information on like costs and things, but they also get what they call a star rating.
Oh, okay.
So every plan is ranked on a star rating of 1 through 5 stars. So you can see directly on there how well that plan is compared to others. They look at things like customer service, accuracy of drug pricing, and they also look at overall health of patients who have that plan. So the better that they do, being on the right medications, taking the medications on the proper time, making sure everyone has different immunizations, they get a higher star rating. So you can actually look and compare and say, okay, well, this plan is 3 stars versus 4 stars versus 1 star, and you get a good general overview of that individual plan.
Oh, that's neat. I didn't realize that, so that's nice to know.
Yeah.
You mentioned as part of that the immunization rate, and again, we're at a time of year where you have flu season and that type of thing. Maybe we could talk a little bit about immunizations and what's the role of the pharmacist in that, and how do you get involved?
Sure. So in the state of Ohio, pharmacists can administer just about every vaccine available, especially for adults. We can do some kids' immunization. So, for instance, the flu vaccine, we can administer that to children 7 years and older in the state of Ohio.
Okay.
If there's a vaccine, whether it's a travel vaccine, if you're going out of the country, just need a pneumonia or a flu, we can handle that all at the pharmacy now. We're really starting to see a big push for pharmacists being the primary immunizers in our community.
Oh, is that right?
Yeah.
That's a new, so that's in the last 5-10 years.
Yeah, this is kind of a newer thing. We've, it started off kind of slower where we were just able to give like the flu shot, the pneumonia shot, and it's really expanded here in the last couple of years. We've really, especially at Ohio Pharmacists Association, have really tried to get some legislation passed to allow us to be able to administer most of the vaccines, and now we can.
Yeah. Yeah, in fact, I was on the site, and I think there's a couple bills pending for some other expansion of that.
Yeah.
There's a whole list of things that you'll be able to do if that passes.
Yeah, absolutely.
Does that come under what's called medication therapy management, I guess? This sort of holistic approach?
Absolutely. So medication therapy management, or MTM that we call it in the pharmacy world, is really what pharmacists do on a daily basis. So it's really more of a focused one-on-one counseling with the patient, really kind of reviewing your medications together. We want to make sure that you're comfortable with your medications, that you know everything that you can possibly know about it, and that it's working properly for you. A lot of times medications might have side effects, or cost may be an issue, or maybe you're not on the best medication for you. So pharmacists are the drug expert. I always say if you have a heart problem, who do you go to? You go to the specialist, the cardiologist. If you have a medication problem, come to the medication specialist. That's the pharmacist. So we're there to answer those questions for you, make sure the medications that you're on are working the way that they should be, hopefully without any side effects. We're going to be able to help keep those costs down. And then if there is a need, such as immunizations, we can address that for you because we know what is recommended for you. And we're able to not only talk about things like immunizations, but we're actually there to provide them for you if you need them.
The question that comes up is because I've had this personal experience with some insurances, and I don't know if this is for Medicare or not, because I'm not yet on Medicare, but they force you to go sort of through a mail order situation. How can you still work with people in that situation where they pretty much if you want to get the medications you have to go through the mail order, but yet you'd like to continue to have a relationship with a pharmacist?
Sure.
How does that work? Are you able to talk to people in that situation?
Yeah, and I would definitely encourage it if your insurance plan would like you to go to mail order, and usually you can save a lot of money doing that too, so it's not always a bad thing. But please know your local pharmacist. We are more than able to talk to you about any medication. Whether or not it's filled at our pharmacy or somebody else's pharmacy or you receive it through the mail, please come to us. We know the medications and we can help you the best that you can. And it's good to have a local advocate for yourself for your medications too.
Right. Well, and the doctor, when you go to see a doctor, a lot of, it depends. I mean, some days they're more busy than other times. But, it could be difficult to be able to go through the whole list with the doctor because they're talking about other things that, you need to do or, tests you need.
Sure.
So how does that work in terms of dealing with personal physicians? Does a person have to give you the authority, I guess is the word, to talk to a person's doctor, or are you allowed to do that through law, or how does that work?
Through the HIPAA laws, which is all of the privacy laws, we are able to talk to other healthcare providers as long as you are a patient of ours. Okay. So if we had a question about, say, yourself, and we wanted to talk to your physician, we're able to do that because we have that connection with you medically. So it's a great time, and I always suggest, especially for seniors on Medicare, schedule an appointment with your pharmacist. Okay, when we're talking about medication therapy management, one of the biggest key proponents of that is your annual medication checkup.
Oh, good.
Okay. You might receive information from your health plan on that in the mail. Technically, it's called a comprehensive medication review. So what that is you bring all your medications in, prescription, and of course, over-the-counter herbals. We want to talk about everything because there can be some interactions. And we'll just take some time with you and talk about the medications. We'll go through each one, figure out what we're using it for, how we should take it, what we should do if maybe we miss a dose. That's an important question. Do I take it now? Do I wait till tomorrow? These are the kind of questions that we like to address. And what hopefully this will do, it will make you more familiar with your medications. So when you go back to your doctor, you can tell them, this is what we discussed. This is what might be going on. Is there maybe a better option for me? Is there something to look at? So like you mentioned, physicians, doctors have not a lot of time with you all the time. So we want to make that visit very beneficial and important. So we want to give you things to talk about, things to address.
Yeah, I've mentioned to folks maybe, when you're going to see your doctor, it's a good idea to have questions written down, your plan of action.
Yeah.
And I would think with this meeting it would be the same, for people going in to see their pharmacist.
Yeah.
Write down if you have specific questions about, particular pills or things that are going on with maybe you have some symptoms or adverse reaction to something.
Yeah, you might be having a reaction and not even think of it as coming from a medication. Maybe you're having problems sleeping at night, so you're trying medications you can buy in the pharmacy to help you sleep. Well, maybe it just has to do with the time that you're taking one of your medications. It's something very simple. So, I think it's very important to know the names of your medication. That's first off. Be familiar with what you're on. What is the brand name of the medication? What is the generic name of the medication? When should I take this medication? That's really important. Should I take it on an empty stomach? Should I take it with a meal? Should it be at nighttime? Should it be in the morning? How does the medication fit into your normal schedule? Is there anything to watch out for? Should I not take this medication and then get in my car and drive? That's important.
Right.
So a lot of the medications might have some particular things to watch out for. But it's also good to know how the patient needs to know, how do I know if this medication is working for me? So maybe it's good to know what kind of results you can expect from it.
Yeah, there are a lot of things that'll combine and they may or may not work together too well. So, and again, I'm thinking about, just from family history of people who had low blood pressure because they were taking another type of pill. and that might cause a fall or lightheaded, that kind of thing. So you've got to really look at your combination of meds.
Right, and when you meet with the pharmacist for this medication review, what we'll do is we'll actually come up with a plan together. So you'll be able to walk out of that meeting with your personal medication list. So every medication that you're on, it'll say what it's used for, the directions, how to take it. But then we'll also talk about kind of an action plan together. So if there's something that you need to work on or talk to your doctor about, we'll give that right to you, and it'll say, this is what I need to work on. This is what I'm going to do. So those are the kind of things that really help you really improve on your medication use, make that conversation with your physician go a lot smoother.
When you're working at the store where you're at, how much time are you able to give to individual folks? Because I imagine you're pretty busy yourself.
Right.
So how do you manage to work these meetings into what you have to do, in terms of, the phone calls coming in and all that stuff?
Right. As you've seen probably in any pharmacy that you walk into, it is a busy environment. But there's a lot of different things that we do on a daily basis to help free us up for more time for you. Never feel overwhelmed. If you walk into the pharmacy and you have a question or a concern, please ask to speak with a pharmacist, and we will take the time to go through it with you, because that's what's most important. Okay.
Right.
And some pharmacies will even schedule, say, appointments for the really formal sit down interview. So, talk to your pharmacist, see if there's a good time to come in, and, we can spend that time so it doesn't feel rushed. Pharmacists are one of the most accessible healthcare providers there are, right? We're open almost all the time. We're on every corner. We're there when the doctor's offices are closed and you can't get a hold of your doctor. So that's what we're there for. And that's why we all became pharmacists, is to help our patients with their health, with their medications.
Can you talk a little about people who are in, with some chronic situations, whether it's diabetes or something like that? How do you work with, just again, diabetes has been in the news a lot.
Yeah.
How do you work with folks like that to try to get the best results for those folks?
Sure. So diabetes, I always say now, is a disease of prevention. So everyone knows somebody who has had a problem with diabetes, someone who's lost their eyesight or maybe lost a foot or had just terrible time with diabetes. So the good thing about it is all of those complications that we hear about are all preventable. And diabetes is a chronic disease that patients really can make a big impact just in their daily life. So our goal when we're meeting with patients who have diabetes is to make sure that they have the tools that they need. Do you have a glucose meter? Do you know how to use it to check your blood sugar every day?
Right.
Do you know what it means to have a high reading before a meal or after a meal? We look at things to help prevent things such as, we talk about foot care. Are you checking your feet on a daily basis? Medications is huge. So diabetes is something where a lot of patients have kind of that free reign from the doctor to kind of adjust their maybe insulin doses and things like that. So, we find out a lot that a lot of patients, especially if you're brand new to diabetes, you've just been diagnosed, you come into the pharmacy, you have 5 brand new prescriptions, you're given this meter and told to check your blood sugar 3 times a day.
Right.
But that's it, so they really need that follow-up education, and it's something that we're in the perfect situation to provide, because we know the medications, we know how they're going to affect your body and how they're going to help improve your health care. My goal is to empower the patient to really manage their medications and their health, because they're the ones who feel the disease. They're the ones who are managing it on a daily basis.
Right.
You might see your doctor every few months, you might come to the pharmacy monthly, but you really need that education for your own self-management of some of these disease states.
Yeah, there's a whole list of activities, I guess, under that medication therapy management, and we've been talking about disease management, I guess, is sort of under that. You've got other things like, and you addressed a little bit about this, but like medication safety.
Yeah.
I think, that's one of the concerns, I think, for older adults is you've got this whole pile of things.
Right.
And making sure that it gets into the proper, if you have a pill holder.
Yeah, pill holders are great.
A lot of people will cut pills in half because, you can stretch them out, or not stretch them out, but I mean, they come in a certain size. It's cheaper if you do it that way.
Right.
So what are some of the things that, again, you could help people with in terms of safety of, you know, and you know, working with their meds at home?
Sure. So the biggest thing, and I love the idea of a pill dispenser. That's the best way to keep track. Did I take my morning medications or not? You can look directly at your morning pill dispenser and see that you took it. That will help you prevent like missing medications, which we want to try and take as many doses per day, per week as possible. You know, we don't want to miss our medications, but we also don't want to take too many. So we want to make sure, you know, you wake up in the morning and did I remember to take my morning medications or did I not? You know, so having, say, a pill dispenser kind of broken out and having kind of a plan and how I'm going to manage these medications, especially when I'm on a handful of different types, it definitely can be confusing. So again, speaking with the pharmacist, figuring out, first of all, when you should take each one is really step one. You know, know your medications, know how they're going to affect you. Know if, you know, you mentioned blood pressure medicines. Is this one going to make me lightheaded or dizzy? Maybe I should take it at night versus first thing in the morning if I'm going to be out all day. So there's so many different things that can really help with the safety of medication. And it's all based on best timing, take it with food, without food, how to prevent some of those side effects that we hear about.
One other thing, we've had some experts on about Alzheimer's, Dr. Wilkins locally, and I just you know, wanted to ask if there are any kind of hopeful medications that have just come out, or you know, things that, obviously there's no cure, but things that maybe delay some of the worst symptoms. Do you work with those?
We do, and I actually spent, in my pharmacy training, I spent some time with Dr. Wilkins. So, but yeah, there's a lot of different medications that are kind of in the pipeline. We have a lot of good medications right now that can help slow the progression of Alzheimer's, which has really made a big difference in a short amount of time. But there is a lot of new things that they're looking at, new ways, new targets for the medications to work. So I think that's one thing that we're going to definitely see some improvement on, and I'm hoping in the short future.
Well, and how about other, you know, again, chronic diseases? We talked about diabetes, and there, you know, what are some of the cancer, obviously. But, are there some things that have come out just since you've been around 10 years that are, you know, really you're seeing some positive benefits? Yeah,
there's a lot. Even if you just think about something that is as common as high blood pressure. You know, high blood pressure can unfortunately be difficult to treat, and sometimes it takes 2 or 3 or sometimes even 4 different types of medications just to treat that. Cholesterol is another big one. So there's been some updates in the cholesterol management guidelines where they're recommending some sooner start of medications such as the statin medications. Like these are things like Lipitor and Crestor, things that you might be familiar with or might have heard of. So we're seeing a lot more people started on a lot of these medications, and it's all coming from the fact that we can prove that it helps prevent things like heart attacks and strokes just by being on these medications. And certain disease states, your age, risk, family history, all of these kind of go into your risk for some of these issues, which might definitely, you know, have the doctor kind of select one medication over the other, start it sooner than the other, those kind of things.
At the beginning, you talked a little bit about seeing the whole picture, not only prescription meds, but also over-the-counter things and some of these supplements. And if we have a few minutes left, but could you talk a little bit about some of the supplements that people take? I think of the things you see on TV, a lot of the ads, you know, for memory and you know, ginkgo and those kind of things.
Yeah, ginkgo is a good one for memory that we see a lot of. And like I said, just because it's over the counter or maybe an herbal doesn't necessarily mean it's safe, especially with your medication. So I always recommend everyone needs to tell your doctor if you're taking something. Tell your pharmacist. For instance, a common one, St. John's wort. A lot of people use it for depression and mood. That one has so many drug interactions that it's really something that we need to know about in the pharmacy, and your doctor needs to know about in the pharmacy. So alternative medicine is great, but we just want to make sure that we stay on top of it and that we know about it, because there can be issues. And we want to make sure that works well for you.
Well, even simply vitamins. it's good to have vitamins and supplements can be beneficial, but
Sure.
you could overdo that too.
You can, yeah. Certain vitamins, certain things can build up in your body. Other ones, you can only take so much and your body gets rid of what's not needed. So it's definitely important, and you might not need to be on it. So we find a lot of times that patients are taking more herbal or over-the-counter medications than they are prescription medications.
Right.
Maybe some are duplications, maybe some aren't needed.
Right. And another thing that just came to me, again, thinking about family situations, I think you probably want to stress that it's never a good idea to borrow somebody else's meds, because I've heard of that where, I ran out, but, my brother has this or my neighbor, and, they gave me their pills.
Yeah,
so
medications are very individualized. Please do not share medications, because something that works for your family member or relative or friend may not work for you.
Yeah. Well, we have a couple minutes left, and I think you were going through some of the questions, but is there anything else that people should ask their pharmacist again when they go to talk to them?
So think about, one of the things we didn't touch on is, how do I store this medication? Are you on a medication that needs to be refrigerated? Is it something that you can carry with you? What side effects may occur, and what do I do if they occur? That's something that we really need to look out for. I think the biggest thing is, what do I do if I miss a dose? And that's something that's very individualized based on what medication you're on.
So again, you would bring that question in, if you have missed a dose, just call into the pharmacy?
Yeah, call into the pharmacy. We'll take a look and see what other medications you're on, see what time it is, when you're supposed to take it. There's a lot of different factors that go into it, and we'll definitely simplify that process for you.
Okay. And again, I don't think we did this at the top, but why don't we give out some contact information if people had questions for you? Is it okay that they give you a call?
Yeah, absolutely. You can reach me at 330-726-7142 and just ask for Kevin. I'll be more than happy to return your call if I'm unable to reach you. But if you have questions on your medications, on medication therapy management, if you'd like to schedule a comprehensive medication review, or maybe you just want to come in and get your flu shot, now's the time. Let us know. Absolutely.
And how good the flu shot is for this season?
Yeah.
But I mean, what's the latest that people could you come in after the beginning of the year?
Absolutely. And the flu really has not hit in this area yet, so it's definitely not too late. It takes about 2 weeks for it to really to kick in. So the sooner the better, but we may see flu into February, March of next year.
And what are some of the other immunizations besides flu again?
Pneumonia vaccines, there's a couple different ones based on your age. The shingles vaccine, that is a huge one. That is approved now for everyone over the age of 50. So if you've ever had chicken pox, you need a shingles vaccine.
Oh, okay.
Yeah.
So that's for anybody who's had...
Anyone's had chicken pox or been exposed to anyone who has had it. So really we look at, if you're 50 or older, it's something that, 1 in 3 people will get shingles in their lifetime. Okay, as we get older, it drops to 1 in 2. So definitely, this is a very important vaccine. It's a terrible rash that occurs, that shingles rash. So
okay, so that's something to
call
your pharmacist.
Talk to your pharmacist about it. We can do it right at the pharmacy.
Well, thanks, Kevin.
Yeah.
We've again been talking with Kevin Fuschetto. He is with Giant Eagle at the Boardman store, and hopefully you've learned some things. I have.
Yeah.
So I appreciate your coming on.
Yeah, thank you.
You've been watching Senior Focus. I'm your host, Bill Adams, and again, we come to you twice a month from Channel 20 and 100 on Armstrong Cable. Thank you to Greg Roten, who brings the show to you. And again, thanks to the public library system here. We're at the Austintown Library, but all the branches in the area have some great resources, and that's what they're there for. Go out and use your library. Till next time, thank you for watching.